Hello, future midwives. Welcome to Nursing Exam Preparation, your trusted partner in mastering the art and science of midwifery nursing. In today's video, we'll walk you through 250 true-false questions focused on midwifery nursing, a vital area that blends skill, compassion, and knowledge to support mothers and newborns through one of life's most profound experiences. Each question is carefully crafted to test your understanding, enhance your grasp of core midwifery concepts, and deepen your insight into safe and effective maternal and neonatal care. After every question, we'll provide a thorough explanation of the correct answer, helping you understand not just the what, but the critical why behind it. Whether you're at the beginning of your midwifery studies or preparing for those crucial exams, this video is packed with essential knowledge to build your confidence, sharpen your clinical reasoning, and guide you toward success. Don't forget to like, share, and subscribe to Nursing Exam Preparation for more valuable resources tailored to your learning journey. Hit the bell icon to stay updated with our latest videos. We're committed to helping you succeed with engaging and practical content. Once you've completed the quiz, share your score in the comments below. We're excited to celebrate your progress. Let's jump in and take another step toward becoming a skilled and confident midwife, ready to make a difference in the world of maternal and newborn care. 1. A midwife can provide medical care during labor and delivery. True or false? Answer: true. Rationale: midwives are trained to provide medical care during labor and delivery, including monitoring the progress of labor, assisting with delivery, and providing appropriate interventions as needed. They can manage uncomplicated births and collaborate with obstetricians for high-risk deliveries. 2. A vaginal exam during labor is necessary for all women to assess cervical dilation. True or false? Answer: false. Rationale: vaginal exams are not always necessary for every woman in labor. The decision to perform a vaginal exam should be based on clinical indications, such as assessing labor progress or checking for complications. Overuse of vaginal exams may lead to unnecessary interventions. 3. Routine screening for gestational diabetes is performed between 24 to 28 weeks of pregnancy. True or false? Answer: true. Rationale: routine screening for gestational diabetes is typically performed between 24 and 28 weeks of pregnancy using a glucose challenge test. This timing helps detect women at risk for gestational diabetes to prevent complications for both mother and baby. 4. Midwives are only qualified to care for low-risk pregnancies. True or false? Answer: false. Rationale: while midwives primarily provide care for low-risk pregnancies, many midwives are trained to provide care for high-risk pregnancies in collaboration with obstetricians or other specialists. Some midwives, particularly those with advanced training, may provide care for higher-risk cases. 5. A midwife can legally perform a cesarean section. True or false? Answer: false. Rationale: midwives are not authorized to perform cesarean sections, as this is a surgical procedure that requires the expertise of an obstetrician or surgeon. Midwives typically refer women who require a cesarean section to an obstetrician. 6. Immediate skin-to-skin contact between mother and baby after birth is beneficial for both. True or false? Answer: true. Rationale: immediate skin-to-skin contact promotes bonding, regulates the baby's body temperature, and encourages successful breastfeeding. It also reduces stress and helps stabilize the newborn's heart rate and breathing. 7. Perineal massage during the second stage of labor can reduce the risk of perineal tears. True or false? Answer: true. Rationale: perineal massage during the second stage of labor has been shown to reduce the risk of perineal tears. This practice helps increase the elasticity of the perineal tissues, preparing them for the delivery of the baby. 8. Midwives can prescribe medications for pain management during labor. True or false? Answer: false. Rationale: in many countries, midwives are not authorized to prescribe medications for pain management. However, they may offer non-pharmacological methods such as breathing techniques, water immersion, or provide support for epidural placement if appropriate. In some settings, midwives may have limited prescribing authority depending on local laws and regulations. 9. Monitoring fetal heart rate, FHR, during labor is essential for detecting signs of fetal distress. True or false? Answer: true. Rationale: monitoring fetal heart rate, FHR, is a key component of labor management as it helps identify signs of fetal distress or hypoxia. Abnormal FHR patterns can prompt timely interventions to protect the health of both mother and baby. 10. A midwife can provide postpartum care for both the mother and the newborn. True or false? Answer: true. Rationale: midwives provide comprehensive postpartum care, including monitoring the mother for complications like hemorrhage, managing breastfeeding, and supporting the newborn's health through assessments, such as checking for jaundice and ensuring proper feeding. 11. Midwives can perform an episiotomy if necessary during delivery. True or false? Answer: true. Rationale: midwives are trained to perform episiotomies when necessary, although it is generally reserved for cases where there is a need to expedite delivery or prevent more severe perineal tears. Episiotomies are becoming less common due to evidence supporting natural tearing over surgical intervention. 12. The presence of meconium-stained amniotic fluid always indicates fetal distress. True or false? Answer: false. Rationale: while meconium-stained amniotic fluid can indicate fetal distress, it is not always the case. Meconium can be passed by the fetus in utero without any signs of distress, and the baby can still be born healthy. Careful monitoring and immediate assessment of the newborn are essential to determine if intervention is needed. 13. The APGAR score is used immediately after birth to assess a newborn's health. True or false? Answer: true. Rationale: the APGAR score is assessed at 1 and 5 minutes after birth to evaluate a newborn's overall health and need for immediate intervention. It includes assessments of appearance, pulse, grimace, activity, and respiration. 14. A midwife is trained to manage postpartum hemorrhage without medical assistance. True or false? Answer: false. Rationale: while midwives are trained to manage postpartum hemorrhage with initial interventions such as uterine massage, administering medications, e.g., oxytocin, and maintaining airway support, they are not typically equipped to handle severe cases without medical assistance. In cases of severe hemorrhage, the midwife should call for emergency medical support. 15. A midwife can provide prenatal care, including ultrasounds, for every pregnant woman. True or false? Answer: false. Rationale: midwives may provide prenatal care, but the ability to perform ultrasounds typically requires additional training and certification. In most settings, ultrasound scans are performed by sonographers or other trained specialists. Midwives often refer clients for ultrasounds as needed, especially for high-risk pregnancies. 16. Vaginal birth after cesarean, VBAC, is an option for some women with a previous cesarean. True or false? Answer: true. Rationale: VBAC is a safe option for many women who have had a previous cesarean section, depending on factors such as the type of incision used and the overall health of the mother and baby. Midwives may provide care for VBAC pregnancies in appropriate settings, with careful monitoring and collaboration with an obstetrician, if necessary. 17. A midwife is not responsible for monitoring a baby's temperature immediately after birth. True or false? Answer: false. Rationale: midwives are responsible for ensuring that the newborn's temperature is closely monitored immediately after birth. This helps prevent hypothermia, which is a significant risk for newborns. Keeping the baby warm through skin-to-skin contact and appropriate clothing is essential. 18. Early breastfeeding within the first hour of birth can help stimulate milk production. True or false? Answer: true. Rationale: early breastfeeding, ideally within the first hour, stimulates the production of milk and strengthens the maternal-infant bond. This early initiation also helps establish effective latch and sucking, which is critical for breastfeeding success. 19. It is safe for a woman to labor in any position she prefers. True or false? Answer: true. Rationale: in most cases, women can labor in any position that feels comfortable, such as upright, squatting, or on hands and knees. This can promote better fetal positioning, reduce pain, and help the labor process progress. However, some positions may need to be adjusted if complications arise, and careful monitoring is essential. 20. The use of a birthing ball can assist in positioning the baby during labor. True or false? Answer: true. Rationale: the use of a birthing ball during labor can help women maintain comfortable and effective positions, aid in fetal rotation, and reduce pain. It is particularly helpful in encouraging pelvic movement and improving the alignment of the baby for birth. 21. Midwives can administer intravenous fluids during labor. True or false? Answer: true. Rationale: midwives are trained to administer intravenous fluids during labor when needed, particularly in cases of dehydration or when women are receiving antibiotics or other medications. However, this is typically done in collaboration with a physician if complications arise. 22. The use of epidural anesthesia is commonly within the scope of practice for midwives. True or false? Answer: false. Rationale: epidural anesthesia is generally outside the scope of practice for most midwives. Midwives can provide pain management techniques like hydrotherapy, massage, and breathing exercises, but epidurals are typically administered by anesthesiologists or other specialized medical providers. 23. A midwife can perform a newborn assessment immediately after birth. True or false? Answer: true. Rationale: midwives are trained to perform immediate newborn assessments, which include checking the baby's heart rate, breathing, muscle tone, and reflexes. These assessments help determine the need for any immediate interventions. 24. A midwife should encourage delayed cord clamping for at least 30 seconds after birth. True or false? Answer: true. Rationale: delayed cord clamping, usually 30 seconds or longer, has been shown to benefit newborns by allowing them to receive more blood from the placenta, which improves iron levels and decreases the risk of anemia. 25. All pregnant women should be screened for Group B streptococcus, GBS, at 35 to 37 weeks of pregnancy. True or false? Answer: true. Rationale: Group B streptococcus screening is recommended for all pregnant women between 35 and 37 weeks. If a woman tests positive, she may receive antibiotics during labor to reduce the risk of transmitting the infection to the baby. 26. A midwife is responsible for providing emotional support during labor and birth. True or false? Answer: true. Rationale: one of the key roles of a midwife is to provide continuous emotional and physical support throughout labor. This includes reassurance, guidance, and encouragement, which have been shown to reduce the need for pain medication and improve birth outcomes. 27. Midwives always deliver babies in hospitals. True or false? Answer: false. Rationale: midwives may deliver babies in various settings, including homes, birthing centers, and hospitals. The setting often depends on the woman's health, pregnancy risk, and personal preferences, as well as the availability of necessary support. 28. The midwife's role is limited to providing support during labor, not pregnancy or postpartum care. True or false? Answer: false. Rationale: midwives provide comprehensive care that includes prenatal, labor, and postpartum care. They monitor the pregnancy, provide prenatal education, assist during birth, and support the mother in the postpartum period, including breastfeeding and recovery. 29. A midwife can diagnose complications such as preeclampsia during pregnancy. True or false? Answer: true. Rationale: midwives are trained to identify and diagnose complications such as preeclampsia. They monitor blood pressure, protein levels in urine, and other clinical signs during prenatal visits, referring women to a physician if needed for further care. 30. Continuous electronic fetal monitoring is recommended for low-risk pregnancies. True or false? Answer: false. Rationale: continuous electronic fetal monitoring is typically reserved for high-risk pregnancies. For low-risk pregnancies, intermittent fetal heart rate monitoring may be just as effective in identifying signs of fetal distress while allowing more mobility and comfort for the mother. 31. A midwife can assist with a water birth in a hospital setting. True or false? Answer: true. Rationale: midwives are trained to assist with water births, and many hospitals offer this option for low-risk pregnancies. The water can provide pain relief and comfort, and midwives ensure that both mother and baby are monitored for safety during the process. 32. Midwives do not provide postpartum contraception counseling. True or false? Answer: false. Rationale: midwives are trained to provide postpartum contraception counseling. They can offer advice on birth control options, including the timing of resuming contraception after childbirth and providing support for family planning decisions. 33. Midwives are only trained to attend vaginal births and cannot assist in cesarean sections. True or false? Answer: true. Rationale: midwives are trained to manage vaginal births and assist with normal labor. However, they are not trained to perform cesarean sections. If a cesarean is needed, midwives collaborate with obstetricians for the procedure. 34. Midwives can offer prenatal education about nutrition and exercise. True or false? Answer: true. Rationale: midwives provide comprehensive prenatal education, including advice on nutrition, exercise, and lifestyle modifications. They help women make informed decisions to optimize maternal and fetal health throughout the pregnancy. 35. Perineal tears during childbirth are more common in first-time mothers. True or false? Answer: true. Rationale: perineal tears are more common in first-time mothers due to the less flexible nature of the perineum. However, midwives are trained to support the perineum during birth and may perform perineal massage to reduce the risk of tearing. 36. Midwives always provide pain relief medication during labor. True or false? Answer: false. Rationale: midwives generally encourage natural pain relief methods such as water immersion, breathing exercises, and massage. While they can administer certain medications if necessary, midwives often focus on non-pharmacological methods first, respecting the mother's preferences. 37. The midwife's role ends immediately after the baby is delivered. True or false? Answer: false. Rationale: the midwife's role continues after delivery, providing postpartum care to the mother and newborn. This includes monitoring the mother's recovery, managing potential complications, and assisting with newborn care such as breastfeeding initiation and ensuring proper bonding. 38. Breastfeeding within the first hour of life helps the baby's immune system. True or false? Answer: true. Rationale: colostrum, the first milk produced after birth, is rich in antibodies and nutrients that help boost the newborn's immune system. Early breastfeeding also promotes bonding and encourages effective lactation. 39. Home births are always safe for both mother and baby. True or false? Answer: false. Rationale: home births can be safe for low-risk women with trained midwives, but they are not without risks. The safety of home births depends on various factors such as the mother's health, the proximity to medical facilities, and the midwife's experience. For high-risk pregnancies, hospital births are generally recommended. 40. Midwives can perform newborn screenings for hearing loss. True or false? Answer: true. Rationale: midwives can perform or assist with newborn screenings, including hearing tests. Early screening for hearing loss is essential to detect potential issues that could affect language development and learning. 41. The crowning stage of labor is when the baby's head emerges fully from the birth canal. True or false? Answer: true. Rationale: crowning refers to the stage in labor when the baby's head becomes visible at the vaginal opening. This is the final phase before the baby is fully delivered. 42. It is safe to give birth while lying flat on the back. True or false? Answer: false. Rationale: while lying flat on the back is common in many hospital births, it is not the most optimal position for laboring women. It can reduce blood flow to the uterus and placenta. More favorable positions include upright, side-lying, or hands and knees positions to support better circulation and fetal positioning. 43. All women who have a previous cesarean section must have a repeat cesarean in subsequent pregnancies. True or false? Answer: false. Rationale: many women who have had a previous cesarean section can safely attempt a vaginal birth after cesarean (VBAC) in subsequent pregnancies. Factors such as the type of incision, the number of previous cesareans, and the health of the mother and baby are considered when making this decision. 44. Midwives cannot legally assist with the delivery of twins. True or false? Answer: false. Rationale: midwives can assist in the delivery of twins, provided the pregnancy is uncomplicated and both babies are in a favorable position for vaginal delivery. However, they will typically collaborate with obstetricians for higher-risk twin pregnancies or deliveries requiring medical intervention. 45. Midwives are trained to provide emergency neonatal resuscitation, if necessary. True or false? Answer: true. Rationale: midwives are trained in neonatal resuscitation, which includes assessing the newborn's breathing, heart rate, and oxygenation. They are equipped to perform basic resuscitation and stabilize the newborn until more advanced medical support is available if needed. 46. Midwives can attend breech deliveries in all circumstances. True or false? Answer: false. Rationale: while midwives are trained to assist with breech deliveries under specific conditions, such as if the breech is not complicated, many midwives refer breech pregnancies to obstetricians or require hospital settings for safe delivery. The risk of complications in breech deliveries requires careful assessment and planning. 47. The first postpartum visit should occur within 1 to 2 weeks after birth. True or false? Answer: true. Rationale: the first postpartum visit usually occurs within 1 to 2 weeks to assess the mother's physical and emotional recovery, monitor for complications such as infection or hemorrhage, and provide support for breastfeeding and infant care. 48. Midwives are legally required to perform routine prenatal screenings for HIV. True or false? Answer: true. Rationale: midwives are legally required to provide routine prenatal screenings for HIV, as early detection allows for interventions to prevent mother-to-child transmission and to provide appropriate care and counseling. 49. It is safe to administer oxytocin to stimulate labor in all pregnant women. True or false? Answer: false. Rationale: oxytocin is typically used to induce or augment labor in certain cases. However, it is not appropriate for all women, especially those with contraindications such as a previous cesarean with a high-risk scar, uterine abnormalities, or fetal distress. Its use should be carefully monitored. 50. Midwives are responsible for performing routine screenings for cervical cancer during pregnancy. True or false? Answer: false. Rationale: while midwives provide comprehensive prenatal care, cervical cancer screenings, such as pap smears, are typically not performed during pregnancy unless indicated by clinical signs or a history of abnormal pap tests. These screenings are usually done as part of routine gynecological care. 51. A vaginal birth is always preferred over a cesarean section for first-time mothers. True or false? Answer: false. Rationale: while vaginal birth is generally preferred for first-time mothers due to its lower risk of complications, a cesarean section may be necessary if complications arise, such as fetal distress or failure to progress in labor. Midwives assist in identifying when a cesarean section is required. 52. A midwife can assist with a water birth, even if the baby has meconium in the amniotic fluid. True or false? Answer: false. Rationale: water births are generally not recommended if meconium is present in the amniotic fluid due to the increased risk of aspiration. In such cases, healthcare providers may recommend a hospital birth or close monitoring to ensure the baby receives appropriate care after delivery. 53. A midwife should always be present during the third stage of labor to assist with placenta delivery. True or false? Answer: true. Rationale: the third stage of labor, which involves the delivery of the placenta, requires close monitoring to ensure that the placenta is expelled safely and that there are no complications such as postpartum hemorrhage. Midwives are trained to manage this stage of labor and intervene if necessary. 54. Midwives provide routine newborn screening tests for metabolic disorders. True or false? Answer: true. Rationale: midwives are trained to perform or assist with routine newborn screenings, including tests for metabolic disorders like phenylketonuria, PKU, and hypothyroidism. These screenings are essential for early detection and treatment to prevent serious health complications. 55. During labor, A midwife is responsible for monitoring the fetal heart rate and maternal vital signs. True or false? Answer: true. Rationale: one of the primary roles of a midwife during labor is to monitor the fetal heart rate and maternal vital signs, blood pressure, temperature, pulse. This helps assess the well-being of both the mother and the baby and ensures timely interventions if complications arise. 56. Midwives can administer pain relief medications, such as narcotics, during labor. True or false? Answer: false. Rationale: midwives typically do not administer narcotics or other heavy pain relief medications. They are trained to offer non-pharmacological pain relief options like breathing exercises, positioning, and water immersion. In some cases, midwives may collaborate with anesthesiologists or physicians for pain management options. 57. Midwives can perform manual removal of the placenta if it does not expel naturally. True or false? Answer: false. Rationale: if the placenta does not expel naturally, manual removal is a medical procedure that requires the expertise of an obstetrician or surgeon. While midwives can attempt gentle techniques to encourage placental expulsion, if there are complications, they must refer the patient to medical professionals for further intervention. 58. A midwife can provide prenatal care and labor support for home births. True or false? Answer: true. Rationale: midwives are trained to provide prenatal care, labor support, and postnatal care for home births. However, they carefully assess each woman's pregnancy to ensure she is a good candidate for home birth, with clear safety protocols in place. 59. A midwife can recommend a cesarean section if the baby is in a breech position. True or false? Answer: true. Rationale: while midwives can assist in managing breech pregnancies and may attempt to turn the baby external cephalic version, if the baby remains in a breech position at term, they may recommend a cesarean section or refer to an obstetrician for further management. 60. Midwives can offer guidance on managing prenatal anxiety and stress. True or false? Answer: true. Rationale: midwives are trained to provide emotional and psychological support during pregnancy, including guidance on managing anxiety and stress. They may recommend relaxation techniques, counseling, or referrals to other healthcare professionals if needed. 61. Routine urine testing during pregnancy is done to screen for protein and glucose levels. True or false? Answer: true. Rationale: routine urine testing during pregnancy is important for screening for conditions like gestational diabetes and preeclampsia. Protein in the urine can indicate preeclampsia, while glucose may suggest gestational diabetes. 62. A midwife can attend to women with gestational diabetes without a physician's consultation. True or false? Answer: false. Rationale: women with gestational diabetes require careful monitoring and management. Midwives can help provide basic support, but they must collaborate with physicians for managing the condition and adjusting insulin or other treatments as necessary. 63. Midwives always assist with forceps deliveries. True or false? Answer: false. Rationale: forceps deliveries require specific training and expertise, typically provided by obstetricians. Midwives may assist in supporting the woman during a forceps delivery, but they do not generally perform the procedure unless they are specifically trained to do so. 64. A midwife can conduct prenatal screenings for Down syndrome. True or false? Answer: true. Rationale: midwives can counsel women about available prenatal screening tests for Down syndrome, such as non-invasive prenatal testing, NIPT, or ultrasounds. However, the actual testing and further diagnosis are typically performed by specialists or in collaboration with an obstetrician. 65. Midwives are responsible for monitoring and promoting maternal nutrition during pregnancy. True or false? Answer: true. Rationale: midwives provide guidance on proper nutrition during pregnancy, emphasizing the importance of balanced meals, vitamins, and minerals to support maternal health and fetal development. They often provide education and referrals for nutrition counseling if needed. 66. The use of an epidural is appropriate for all women in labor. True or false? Answer: false. Rationale: While epidurals are a common form of pain relief in labor, they are not appropriate for all women, especially those with certain medical conditions such as infections or low platelet counts. Midwives can help women explore alternative pain management options. 67. Midwives can administer medications for the induction of labor. True or false? Answer: false. Rationale: midwives are typically not authorized to administer medications for labor induction, such as Pitocin or prostaglandins. Labor induction is usually done by obstetricians, but midwives can assist in managing labor once it begins. 68. Midwives always perform a postpartum checkup for mothers and babies. True or false? Answer: true. Rationale: midwives provide thorough postpartum care for both the mother and baby, assessing physical and emotional recovery, breastfeeding support, and newborn health. Postpartum visits typically occur within the first week after birth. 69. A midwife can diagnose and treat postpartum depression. True or false? Answer: false. Rationale: while midwives are trained to recognize signs of postpartum depression, they are not typically responsible for diagnosing or treating it. They can refer the mother to a mental health professional or physician for appropriate diagnosis and treatment. 70. Midwives always perform an episiotomy during vaginal delivery. True or false? Answer: false. Rationale: routine episiotomies are no longer recommended, and midwives generally aim to avoid them unless medically necessary, such as in cases of fetal distress or severe perineal trauma risk. Midwives typically focus on supporting the perineum to minimize tearing. 71. A midwife can provide care for women experiencing a miscarriage during early pregnancy. True or false? Answer: true. Rationale: midwives are trained to provide supportive care for women experiencing early pregnancy loss, including emotional support, counseling, and monitoring for complications. They may also refer the woman to an obstetrician or other healthcare providers if necessary. 72. Midwives can perform ultrasound examinations to assess fetal health during pregnancy. True or false? Answer: false. Rationale: midwives are not typically trained or licensed to perform ultrasound examinations. However, they can refer patients to specialized ultrasound technicians or physicians for fetal assessments when needed. 73. Midwives are trained to recognize the early signs of preeclampsia. True or false? Answer: true. Rationale: midwives are trained to monitor blood pressure, urine protein, and other signs during prenatal visits. Recognizing early signs of preeclampsia allows for early intervention, referral to an obstetrician, and better outcomes for both the mother and baby. 74. Midwives can attend to women with a history of complicated pregnancies without medical consultation. True or false? Answer: false. Rationale: midwives typically provide care for low-risk pregnancies. Women with a history of complicated pregnancies, e.g., gestational diabetes, hypertension, require collaboration with obstetricians or other specialists to manage potential risks. 75. Midwives always perform the first newborn assessment within minutes of birth. True or false? Answer: true. Rationale: midwives are trained to perform a thorough newborn assessment immediately after birth, which includes checking the baby's breathing, heart rate, muscle tone, and reflexes. This helps ensure that the baby is stable and healthy. 76. It is safe for a woman with active genital herpes to give birth vaginally. True or false? Answer: false. Rationale: active genital herpes is a contraindication for vaginal birth, as there is a risk of transmitting the infection to the baby during delivery. A cesarean section is generally recommended in such cases to prevent neonatal herpes infection. 77. Midwives can manage labor for women who are at a high risk of complications, such as women with pre-existing diabetes. True or false? Answer: false. Rationale: women with high-risk pregnancies, such as those with pre-existing diabetes, generally require a more specialized care team, including obstetricians and endocrinologists. Midwives can provide supportive care, but these women typically require more intensive monitoring and interventions. 78. Midwives are trained to perform sutures for minor vaginal tears after delivery. True or false? Answer: true. Rationale: Midwives are trained to repair minor vaginal tears, such as first or second-degree tears, that can occur during vaginal delivery. However, more severe tears often require an obstetrician's intervention. 79. Midwives always deliver babies in a hospital setting. True or false? Answer: false. Rationale: midwives provide care in various settings, including home births, birthing centers, and hospitals. The setting often depends on the risk status of the pregnancy, the woman's preference, and the availability of resources. 80. Midwives should offer prenatal care, including screening for gestational diabetes, to all pregnant women. True or false? Answer: true. Rationale: prenatal care provided by midwives includes regular screenings for conditions like gestational diabetes, which is important for ensuring the health of both the mother and baby. Early detection allows for effective management to minimize complications. 81. Vaginal birth after cesarean, VBAC, is never an option for women who have had a previous cesarean. True or false? Answer: false. Rationale: many women with a previous cesarean section can safely attempt a VBAC, depending on factors such as the type of incision, the number of previous cesareans, and the health of the woman and baby. Midwives often provide support for VBACs in collaboration with obstetricians. 82. A midwife can assist with a cesarean delivery if necessary. True or false? Answer: false. Rationale: midwives are trained to manage normal vaginal deliveries. Cesarean sections are surgical procedures that require the expertise of an obstetrician or surgeon. Midwives may assist in preparation and post-operative care, but they do not perform cesarean sections. 83. The use of a birthing ball can help alleviate discomfort during labor. True or false? Answer: true. Rationale: birthing balls can help relieve discomfort during labor by encouraging optimal fetal positioning, improving pelvic mobility, and providing a comfortable position for the laboring woman. Midwives often encourage their use for pain relief and progress. 84. The practice of midwifery includes providing prenatal and postnatal care, but not labor support. True or false? Answer: false. Rationale: midwifery includes providing comprehensive care across the pregnancy continuum, prenatal care, labor support, and postnatal care. Midwives are specifically trained to support women during labor, assist with delivery, and provide postpartum care. 85. Midwives can conduct routine screenings for sexually transmitted infections, STIs, during pregnancy. True or false? Answer: true. Rationale: midwives conduct routine screenings for STIs during pregnancy to identify and treat infections that could affect maternal and fetal health. Early detection and treatment can prevent complications such as preterm labor or neonatal infections. 86. Midwives can provide routine care for women experiencing a high-risk pregnancy. True or false? Answer: false. Rationale: midwives generally provide care for low-risk pregnancies. High-risk pregnancies, such as those involving pre-existing conditions or complications, often require the expertise of obstetricians or other specialists. Midwives may provide support and refer to other healthcare providers for specialized care. 87. Midwives are trained to assist with water births in a hospital setting. True or false? Answer: true. Rationale: midwives are trained to assist with water births, and many hospitals now offer water birth as an option for low-risk pregnancies. Water immersion during labor can help with pain relief, and midwives monitor the mother and baby's safety throughout the process. 88. Midwives must always obtain informed consent before performing any procedures during labor or delivery. True or false? Answer: true. Rationale: midwives are required to obtain informed consent before performing any procedures during labor or delivery. This includes explaining the benefits, risks, and alternatives to the procedure, ensuring that the woman understands and agrees to the plan of care. 89. Midwives can only assist with deliveries that are planned in advance. True or false? Answer: false. Rationale: midwives can assist with both planned and unplanned deliveries. While they typically plan for home births or births in birthing centers, they are also trained to respond to emergencies and assist with hospital deliveries when necessary. 90. A midwife is responsible for ensuring the proper management of postpartum hemorrhage. True or false? Answer: true. Rationale: midwives are trained to manage postpartum hemorrhage, PPH, which includes monitoring the woman for signs of excessive bleeding, massaging the uterus, administering medications, and initiating emergency measures if necessary to prevent further complications. 91. Midwives should advise pregnant women to avoid all forms of physical activity during pregnancy. True or false? Answer: false. Rationale: physical activity is generally safe and beneficial during pregnancy for most women. Midwives typically recommend exercises that promote strength, flexibility, and relaxation, such as walking, swimming, and prenatal yoga, unless contraindicated by specific medical conditions. 92. Midwives are trained to assist with the management of postpartum depression. True or false? Answer: true. Rationale: midwives are trained to identify the signs of postpartum depression and can provide initial support, including counseling, reassurance, and referrals to mental health professionals for further management. 93. Midwives routinely administer vitamin K injections to newborns. True or false? Answer: false. Rationale: vitamin K injections are typically administered by pediatricians or nurses, not midwives. This injection is recommended to prevent bleeding disorders. As newborns have low levels of vitamin K, midwives can educate parents on the benefits and importance of the injection, but do not usually administer it themselves. 94. It is important for a midwife to monitor the baby's position during labor, particularly for cephalic and breech presentations. True or false? Answer: true. Rationale: monitoring the baby's position during labor is essential, as it can affect the progression of labor and the method of delivery. Midwives assess fetal positioning and may offer interventions like repositioning or refer to an obstetrician if complications such as breech presentation arise. 95. Midwives are permitted to prescribe medications to induce labor. True or false? Answer: false. Rationale: midwives generally do not prescribe medications to induce labor, as labor induction typically requires a physician's involvement, especially if there are medical indications or risks involved. Midwives may recommend non-pharmacological methods or assist with labor support once it has begun. 96. Midwives cannot assist in the care of women with a history of high blood pressure. True or false? Answer: false. Rationale: midwives can assist women with a history of high blood pressure, but these women may require closer monitoring, and midwives will often work in collaboration with obstetricians or other healthcare providers to manage any complications that arise. 97. Midwives are trained to assess and manage newborn jaundice. True or false? Answer: true. Rationale: midwives are trained to assess newborns for jaundice and can manage mild cases through breastfeeding support, monitoring, and referrals to pediatricians if necessary for further treatment, such as phototherapy. 98. A midwife should always assess maternal vital signs, including blood pressure, during labor. True or false? Answer: true. Rationale: monitoring maternal vital signs, including blood pressure, is critical during labor to identify early signs of complications, such as preeclampsia. Midwives are trained to assess these vital signs and intervene when necessary. 99. Midwives are not trained to handle shoulder dystocia. True or false? Answer: false. Rationale: midwives are trained to recognize and manage shoulder dystocia using appropriate maneuvers to help deliver the baby safely, such as the McRoberts maneuver, suprapubic pressure, or by changing the maternal position. They work closely with other professionals if the situation escalates. 100. Midwives can provide care for women planning a home birth as long as they are low risk. True or false? Answer: true. Rationale: midwives often assist with home births for women who are low risk and have normal pregnancies. They are trained to assess risk factors and ensure the home environment is safe for delivery, offering guidance and interventions if complications arise. 101. Midwives can assist in the delivery of multiple births, including twins. True or false? Answer: true. Rationale: midwives are trained to assist with multiple births, such as twins, especially in low-risk pregnancies. However, in cases of complications such as a breech twin, They may consult with an obstetrician or transfer to a hospital for further support. 102. Midwives are not trained to perform cervical exams during labor. True or false? Answer: false. Rationale: midwives are trained to perform cervical exams during labor to assess the progress of dilation and effacement. This helps them gauge the stage of labor and determine whether interventions are necessary. 103. Midwives always use continuous fetal monitoring during labor. True or false? Answer: false. Rationale: midwives often use intermittent fetal monitoring, which is less invasive and allows the mother more mobility during labor. Continuous fetal monitoring is generally reserved for higher-risk pregnancies or when complications are suspected. 104. Midwives can legally perform cervical circlage for women with a history of preterm labor. True or false? Answer: false. Rationale: cervical circlage is a surgical procedure that involves placing a stitch in the cervix to prevent preterm birth. This procedure is generally performed by obstetricians or surgeons, not midwives, though midwives may provide care and monitoring for women with a circlage in place. 105. Midwives should always offer the option of a water birth for low-risk pregnancies. True or false? Answer: false. Rationale: while water birth can be a viable option for low-risk pregnancies, midwives assess the individual situation and ensure that the woman and baby are in good health before offering it. They also consider factors such as the availability of resources and the woman's preferences. 106. A midwife's role ends after the delivery of the baby. True or false? Answer: false. Rationale: a midwife's role extends beyond delivery to include postpartum care for both the mother and baby. This includes monitoring the mother for complications, supporting breastfeeding, and ensuring the newborn's health through assessments and screenings. 107. Midwives always recommend breastfeeding immediately after birth. True or false? Answer: true. Rationale: midwives strongly support breastfeeding as it provides essential nutrients and bonding between the mother and baby. They encourage immediate breastfeeding after birth to establish the baby's first feeding and help stimulate uterine contractions. 108. Midwives should be trained to provide counseling for women who choose to have an abortion. True or false? Answer: true. Rationale: midwives are trained to provide non-judgmental counseling and support for women who choose to have an abortion, including discussing their options, emotional support, and providing information about the procedure. They also refer to specialists or clinics when necessary. 109. Midwives are allowed to prescribe birth control after a woman's postpartum visit. True or false? Answer: true. Rationale: depending on local regulations, many midwives are trained and authorized to prescribe certain forms of birth control, including contraceptive pills, IUDs, or implants, during postpartum visits. They provide guidance based on the woman's preferences and health status. 110. A midwife should always obtain a full history of the mother's previous pregnancies and deliveries. True or false? Answer: true. Rationale: a full history of previous pregnancies and deliveries is crucial for assessing potential risks and tailoring care for the current pregnancy. This helps midwives identify any complications that could affect the current pregnancy or delivery and plan accordingly. 111. Midwives can manage the postpartum care of women with infections, such as mastitis. True or false? Answer: true. Rationale: midwives are trained to manage common postpartum complications, including infections like mastitis. They provide breastfeeding support, recommend appropriate treatment, e.g., antibiotics, and refer women to a physician if the infection becomes severe. 112. Midwives always deliver babies in hospitals with specialized neonatal units. True or false? Answer: false. Rationale: midwives deliver babies in a variety of settings, including home births, birthing centers, and hospitals. They assess the mother's risk level and choose the appropriate setting based on the pregnancy's health status and the family's preferences. 113. Midwives can perform a thorough newborn examination, including checking for congenital conditions. True or false? Answer: true. Rationale: midwives perform a thorough newborn examination immediately after birth, including assessing for common congenital conditions such as cleft lip, heart defects, or hip dysplasia. They will refer to a pediatrician for more specialized care if needed. 114. Midwives can manage labor for women with multiple previous cesarean sections. True or false? Answer: false. Rationale: women with multiple previous cesarean sections typically have a higher risk of uterine rupture and require more specialized care. Midwives may collaborate with obstetricians and specialists to ensure a safe birth plan for women in this category. 115. Midwives can assist in managing labor in women with a history of gestational diabetes. True or false? Answer: true. Rationale: midwives are trained to monitor and manage labor for women with gestational diabetes, ensuring that both the mother and baby are closely monitored for any complications, such as fetal macrosomia or hypoglycemia after birth. 116. Midwives can perform routine pelvic exams during pregnancy for all women. True or false? Answer: false. Rationale: while midwives can perform pelvic exams, they are typically not done routinely unless medically necessary. Pelvic exams are more commonly performed when assessing labor progression, monitoring for infections, or evaluating other concerns. 117. It is standard practice for midwives to routinely test all pregnant women for Group B Streptococcus, GBS, during pregnancy. True or false? Answer: true. Rationale: midwives typically screen for Group B Streptococcus between 35 to 37 weeks of pregnancy, as this bacteria can cause severe infections in newborns if passed during delivery. If positive, antibiotics are often given during labor to prevent transmission. 118. Midwives should always recommend epidural anesthesia for women who experience severe pain during labor. True or false? Answer: false. Rationale: midwives support a woman's birth plan and provide various pain management options, including non-pharmacological methods like breathing techniques, positioning, and water immersion. Epidural anesthesia is an option, but it is not the only recommended approach. 119. Midwives can perform newborn resuscitation in the event of neonatal distress at birth. True or false? Answer: true. Rationale: midwives are trained in neonatal resuscitation and can provide immediate care if the newborn shows signs of distress at birth, such as poor breathing or low heart rate. They can initiate resuscitation until additional medical support arrives if needed. 120. The role of a midwife includes counseling pregnant women about nutrition and lifestyle choices. True or false? Answer: true. Rationale: midwives provide education on healthy nutrition, exercise, and lifestyle choices throughout pregnancy. They offer guidance to promote the well-being of both the mother and baby, reducing risks and supporting healthy pregnancy outcomes. 121. Midwives always perform vaginal deliveries for women with a previous cesarean section. True or false? Answer: false. Rationale: while vaginal birth after cesarean (VBAC) is possible for some women, it requires careful evaluation of risks, such as the type of incision from the previous cesarean. Midwives may support VACs in low-risk cases, but work with obstetricians for higher-risk pregnancies. 122. A midwife should not offer prenatal care to women who have a history of stillbirth. True or false? Answer: false. Rationale: midwives can provide care for women with a history of stillbirth, but these women typically require close monitoring and a more collaborative care plan with obstetricians to manage potential risks in future pregnancies. 123. Midwives can offer emotional support to women experiencing pregnancy loss, but they cannot provide medical management. True or false? Answer: false. Rationale: midwives can offer both emotional support and medical management for early pregnancy loss, including counseling and assisting with any necessary medical interventions, such as monitoring and facilitating the passage of tissue or referral for surgical management if required. 124. Midwives can safely assist in the birth of a breech baby in the home setting. True or false? Answer: false. Rationale: breech deliveries carry a higher risk of complications, and most midwives will refer a woman with a breech presentation to a hospital or consult with obstetricians. In some rare cases, experienced midwives may assist with breech births in controlled settings, but this is generally not recommended at home. 125. Midwives are responsible for ensuring that the baby is immediately placed on the mother's chest after birth to promote bonding. True or false? Answer: true. Rationale: skin-to-skin contact immediately after birth is essential for promoting bonding, regulating the baby's temperature, and initiating breastfeeding. Midwives typically encourage this practice as part of a healthy birth experience. 126. A midwife's care always includes routine screenings for maternal mental health issues such as anxiety and depression. True or false? Answer: true. Rationale: midwives routinely screen for mental health issues such as anxiety and depression, especially during the postpartum period. Early identification and appropriate referrals can help manage mental health conditions and support maternal well-being. 127. Midwives are trained to manage third and fourth-degree perineal tears during delivery. True or false? Answer: false. Rationale: third and fourth-degree perineal tears involve the anal sphincter and rectum, and they generally require surgical repair by an obstetrician or specialist. Midwives can manage first and second-degree tears, but more severe tears require referral to a higher level of care. 128. Midwives should offer mothers education on breastfeeding techniques during prenatal visits. True or false? Answer: true. Rationale: midwives provide prenatal education on breastfeeding techniques to help mothers prepare for a successful breastfeeding experience. This includes positioning, latch techniques, and addressing potential challenges to support the mother and baby. 129. A midwife is responsible for monitoring fetal heart tones during labor to assess fetal well-being. True or false? Answer: true. Rationale: monitoring fetal heart tones is an essential part of assessing fetal well-being during labor. Midwives use intermittent auscultation or external fetal monitors to assess the baby's heart rate and make decisions regarding labor management. 130. Midwives always work independently and do not collaborate with other healthcare professionals. True or false? Answer: false. Rationale: midwives collaborate closely with other healthcare providers, such as obstetricians, pediatricians, and anesthesiologists, especially in cases of complications or high-risk pregnancies. Collaboration ensures comprehensive care for both the mother and baby. 131. Midwives should encourage women to give birth in a hospital setting for the safest delivery. True or false? Answer: false. Rationale: while hospitals offer high levels of medical support, midwives work with women to plan the birth setting based on the woman's preferences, health, and pregnancy risk factors. Home births and birthing centers are also safe options for low-risk pregnancies. 132. Midwives can assist with the delivery of a baby with a nuchal cord around the neck. True or false? Answer: true. Rationale: midwives are trained to manage deliveries with a nuchal cord, often by gently attempting to slip the cord over the baby's head or managing the delivery to ensure minimal risk. If complications arise, they may transfer care to obstetricians. 133. Midwives do not provide routine pap smears as part of prenatal care. True or false? Answer: true. Rationale: pap smears are typically performed by gynecologists or primary care providers rather than midwives. However, midwives may recommend or refer women for screening if needed, particularly if there is a history of abnormal pap smears. 134. Midwives must always obtain a woman's consent before performing a procedure during labor or delivery. True or false? Answer: true. Rationale: informed consent is a fundamental part of midwifery practice. Midwives are responsible for ensuring that women understand and agree to any procedures or interventions, such as cervical exams or epidural administration, before they are carried out. 135. Midwives can perform blood tests and prescribe medications for conditions such as anemia during pregnancy. True or false? Answer: true. Rationale: depending on the scope of their practice and local regulations, midwives may perform routine blood tests, e.g., hemoglobin checks, and can prescribe medications like iron supplements to manage conditions such as anemia. 136. Midwives are required to report suspected cases of child abuse or neglect during pregnancy or after birth. True or false? Answer: true. Rationale: Midwives, like all healthcare providers, are mandated reporters. If they suspect child abuse or neglect, they are legally required to report it to the appropriate authorities to ensure the safety and well-being of the child. 137. Midwives can manage normal pregnancies until the 42nd week of gestation. True or false? Answer: false. Rationale: while midwives can manage pregnancies up to 42 weeks for low-risk women, careful monitoring and assessments are required. After 42 weeks, the risk of complications increases, and referral to an obstetrician for further evaluation and possible induction of labor may be necessary. 138. Midwives always provide care for women with high-risk pregnancies. True or false? Answer: false. Rationale: midwives typically provide care for low-risk pregnancies. Women with high-risk pregnancies are usually referred to obstetricians or specialists for more intensive monitoring and care, although midwives may still offer support in collaboration with other healthcare professionals. 139. Midwives are trained to handle the delivery of a baby in the occiput posterior position. True or false? Answer: true. Rationale: midwives are trained to manage deliveries in a variety of fetal positions, including occiput posterior, OP. While OP can cause more discomfort during labor and slower progression, midwives can assist with positioning techniques to facilitate delivery and reduce complications. 140. Midwives should offer counseling and education on the use of contraception during postpartum care. True or false? Answer: true. Rationale: midwives provide counseling on postpartum contraception options, including birth control pills, IUDs, or natural family planning methods, to help women plan their family and space pregnancies effectively. 141. Midwives are allowed to perform cesarean sections if complications arise during labor. True or false? Answer: false. Rationale: cesarean sections require the expertise of an obstetrician or surgeon. While midwives are skilled in recognizing the signs that a cesarean may be necessary, they must transfer care to a physician for the procedure. 142. Midwives can assist with the management of maternal hypertension during pregnancy. True or false? Answer: true. Rationale: midwives can manage mild maternal hypertension through lifestyle changes and monitoring, and they will refer the woman to an obstetrician if the hypertension worsens or if complications such as preeclampsia develop. 143. Midwives typically perform routine ultrasounds during pregnancy. True or false? Answer: false. Rationale: midwives typically do not perform routine ultrasounds. Ultrasounds are generally conducted by trained technicians or physicians, but midwives may order them for specific clinical indications, such as determining fetal growth or checking for anomalies. 144. Midwives encourage delayed cord clamping to improve neonatal outcomes. True or false? Answer: true. Rationale: delayed cord clamping is recommended by midwives to allow for additional blood volume to be transferred to the baby, which improves iron levels and can reduce the risk of anemia. Most current guidelines support delaying cord clamping for 1 to 3 minutes after birth. 145. Midwives can prescribe antibiotics for infections during pregnancy. True or false? Answer: true. Rationale: depending on the scope of practice, midwives may prescribe antibiotics for mild infections such as urinary tract infections, UTIs, or certain vaginal infections, provided they are trained and permitted to do so by their licensing authority. 146. Midwives should recommend that women with a history of preterm labor remain on bed rest during pregnancy. True or false? Answer: false. Rationale: bed rest is no longer routinely recommended for women with a history of preterm labor, as studies have shown that it does not significantly prevent preterm birth. Midwives typically recommend alternative strategies like regular monitoring, hydration, and avoiding stressors. 147. A midwife's role includes providing newborn screening tests for metabolic conditions. True or false? Answer: false. Rationale: newborn screening tests for conditions such as phenylketonuria, PKU, are typically performed by pediatricians or in hospital settings. However, midwives may facilitate the process and educate parents about the importance of these tests. 148. Midwives can help women with substance abuse issues during pregnancy by providing counseling and referrals. True or false? Answer: true. Rationale: midwives can identify signs of substance abuse and provide support through counseling, as well as refer women to addiction specialists or treatment programs to help manage substance use during pregnancy. 149. Midwives can administer pain relief through epidural anesthesia during labor. True or false? Answer: false. Rationale: midwives are not authorized to administer epidurals, as this procedure requires a trained anesthesiologist or physician. However, midwives can offer other pain management strategies, such as breathing exercises, hydrotherapy, or pharmacological options like narcotics. 150. Midwives are trained to assist in vaginal births after cesarean, VBAC. True or false? Answer: true. Rationale: midwives are trained to assist in VBACs for low-risk women, but they must assess the risk factors and collaborate with obstetricians. The presence of a skilled medical team is often necessary due to the potential risks associated with uterine rupture. 151. Midwives can perform the initial newborn assessment, including the APGAR score. True or false? Answer: true. Rationale: midwives perform initial newborn assessments, including the APGAR score, to evaluate the baby's heart rate, respiratory effort, muscle tone, reflexes, and skin color immediately after birth to ensure newborn well-being. 152. Midwives provide ongoing care during the postpartum period, including breastfeeding support. True or false? Answer: true. Rationale: postpartum care is an essential part of midwifery practice. Midwives provide education and support on breastfeeding, newborn care, and recovery for the mother, helping her transition into the postpartum period. 153. Midwives are trained to recognize and manage shoulder dystocia during delivery. True or false? Answer: true. Rationale: midwives are trained to recognize shoulder dystocia and can manage it using techniques like the McRoberts maneuver or suprapubic pressure. However, they will consult or transfer care to an obstetrician if complications arise. 154. Midwives can perform cesarean sections for women experiencing obstructed labor. True or false? Answer: false. Rationale: cesarean sections require a trained obstetrician or surgeon to perform. Midwives may identify when a cesarean section is necessary and provide initial care, but the procedure itself requires surgical expertise. 155. Midwives always encourage mothers to breastfeed exclusively for the first 6 months. True or false? Answer: true. Rationale: midwives strongly encourage exclusive breastfeeding for the first 6 months, as it provides essential nutrients and immune protection. They support mothers with breastfeeding techniques and address any challenges that may arise. 156. Midwives are responsible for performing a 1 and 5-minute APGAR assessment of the newborn. True or false? Answer: true. Rationale: midwives perform the APGAR score assessments at 1 minute and 5 minutes after birth to evaluate the newborn's immediate health status. The score helps identify whether resuscitation or additional care is needed. 157. Midwives always perform episiotomies during vaginal deliveries. True or false? Answer: false. Rationale: routine episiotomies are no longer standard practice, and midwives typically only perform them if necessary, such as in cases of fetal distress or a difficult delivery. Perineal support and controlled delivery are usually preferred to minimize the need for episiotomy. 158. Midwives can perform the Heimlich maneuver if a newborn is choking. True or false? Answer: true. Rationale: midwives are trained in neonatal resuscitation, including performing the Heimlich maneuver or other appropriate actions if a newborn is choking. They are prepared to manage emergencies and stabilize the newborn until further medical help is available. 159. Midwives are authorized to provide labor support in the presence of complications, such as preeclampsia. True or false? Answer: false. Rationale: while midwives can provide supportive care, they are not trained to manage severe complications like preeclampsia. Women with preeclampsia typically require a higher level of care from obstetricians, including medical management and monitoring for complications. 160. Midwives can assist with labor induction using natural methods, such as herbal remedies or nipple stimulation. True or false? Answer: true. Rationale: midwives may suggest natural methods of labor induction, such as nipple stimulation, acupuncture, or herbal remedies, for women who are near or past their due date. However, these methods are only used when medically appropriate, and midwives always assess the safety of the woman and fetus before proceeding. 161. Midwives are trained to manage both vaginal and cesarean deliveries independently. True or false? Answer: false. Rationale: midwives are trained to manage vaginal deliveries, but cesarean sections require surgical expertise and are performed by obstetricians. Midwives work collaboratively with obstetricians when cesarean delivery is necessary. 162. Midwives should always encourage women to deliver in a supine position during labor. True or false? Answer: false. Rationale: the supine position is not always optimal during labor as it can restrict blood flow. Midwives encourage positions that promote comfort and effective labor progression, such as upright or side-lying positions. 163. Midwives can prescribe and administer Pitocin to stimulate labor. True or false? Answer: false. Rationale: Pitocin, synthetic oxytocin, is typically administered by obstetricians or in a hospital setting. While midwives manage labor, they do not routinely prescribe or administer medications like Pitocin unless under specific conditions and with medical supervision. 164. Midwives can provide prenatal genetic counseling to women at risk for chromosomal abnormalities. True or false? Answer: true. Rationale: midwives can provide prenatal counseling, educate women on genetic screening options, and offer support. However, they typically refer to genetic counselors or specialists for detailed counseling and complex cases. 165. Midwives are trained to diagnose and manage gestational diabetes. True or false? Answer: true. Rationale: midwives can diagnose and manage gestational diabetes through routine screening and lifestyle interventions, including dietary counseling. If complications arise, they may collaborate with obstetricians for further management. 166. A midwife's care plan for pregnancy includes routine blood pressure checks to screen for preeclampsia. True or false? Answer: true. Rationale: midwives monitor blood pressure at each prenatal visit as part of standard care to screen for preeclampsia, a potentially dangerous condition characterized by elevated blood pressure and organ damage. 167. Midwives should always advise women with a history of preterm labor to avoid sexual intercourse during pregnancy. True or false? Answer: false. Rationale: while some women with a history of preterm labor may be advised to avoid sexual intercourse, this is not a universal recommendation. Each case is individual, and midwives provide personalized advice based on a woman's medical history and current condition. 168. Midwives can perform manual placenta removal if it does not deliver spontaneously after birth. True or false? Answer: false. Rationale: manual removal of the placenta is a medical procedure typically performed by an obstetrician. If the placenta fails to deliver spontaneously, midwives will consult or transfer care to a physician for this procedure. 169. Midwives are responsible for checking the newborn's temperature immediately after birth. True or false? Answer: true. Rationale: after birth, midwives check the newborn's temperature to ensure it is within a healthy range, as newborns are at risk for hypothermia, especially in the first few hours of life. 170. Midwives encourage delayed bathing of the newborn to preserve natural oils on the skin. True or false? Answer: true. Rationale: midwives encourage delaying the first bath for the newborn to allow the natural oils, such as vernix, to remain on the skin. These oils help protect the skin and provide warmth. 171. Midwives can perform routine ultrasound scans to monitor fetal development. True or false? Answer: false. Rationale: midwives generally do not perform ultrasounds. These are typically done by sonographers or obstetricians. Midwives can order ultrasounds if clinically indicated, but do not perform them as part of routine care. 172. Midwives should offer education on safe sleep practices for newborns during postpartum care. True or false? Answer: true. Rationale: midwives educate parents about safe sleep practices, such as placing the baby on their back to sleep, avoiding soft bedding, and ensuring a firm mattress, to reduce the risk of sudden infant death syndrome, SIDS. 173. Midwives are trained to use fetal heart rate monitoring to assess fetal well-being during labor. True or false? Answer: true. Rationale: midwives use intermittent fetal heart rate monitoring during labor to assess fetal well-being. Abnormal heart rate patterns can indicate fetal distress and prompt the need for further medical intervention. 174. Midwives should never perform vaginal exams during labor. True or false? Answer: false. Rationale: midwives can perform vaginal exams during labor to assess cervical dilation, effacement, and fetal position. These exams help guide labor management decisions. However, unnecessary exams should be avoided to reduce the risk of infection. 175. Midwives are trained to manage postpartum hemorrhage in a home birth setting. True or false? Answer: true. Rationale: midwives are trained in managing postpartum hemorrhage, even in home birth settings. They use techniques like uterine massage, administering medications such as oxytocin, and preparing for emergency transport if needed. 176. Midwives routinely recommend routine cesarean sections for women with large babies. True or false? Answer: false. Rationale: midwives typically attempt to manage the birth of larger babies with careful monitoring and a variety of techniques. Cesarean sections are considered only if there are complications or the baby shows signs of distress. 177. Midwives provide prenatal care primarily through one-on-one consultations. True or false? Answer: true. Rationale: midwives offer individualized care, providing one-on-one consultations during prenatal visits to assess the woman's health, provide education, and develop a personalized care plan for pregnancy and birth. 178. Midwives are trained to perform suturing for minor perineal tears during vaginal deliveries. True or false? Answer: true. Rationale: midwives are trained to perform suturing for first and second-degree perineal tears. They are skilled in repairing these tears to promote healing and minimize complications. However, third and fourth-degree tears require specialist care. 179. Midwives do not provide prenatal care for women carrying multiples, e.g., twins. True or false? Answer: false. Rationale: midwives can provide prenatal care for women carrying multiples, but they usually work in collaboration with obstetricians. Multiple pregnancies require more frequent monitoring and care due to the increased risk of complications. 180. Midwives should always use continuous fetal monitoring during labor for all women. True or false? Answer: false. Rationale: continuous fetal monitoring is not necessary for all women. Midwives use intermittent monitoring unless there are concerns about fetal well-being. Continuous monitoring is typically reserved for high-risk pregnancies or complications during labor. 181. Midwives can provide non-pharmacological pain relief techniques, such as hypnotherapy and acupuncture, during labor. True or false? Answer: true. Rationale: midwives are trained in non-pharmacological pain management techniques, such as breathing exercises, hypnotherapy, and acupuncture. These methods can help reduce pain perception and support a more comfortable labor experience. 182. Midwives should encourage early skin-to-skin contact between mother and baby to promote breastfeeding. True or false? Answer: true. Rationale: early skin-to-skin contact is essential for successful breastfeeding initiation, as it helps the baby latch onto the breast more effectively and regulates the newborn's temperature and heart rate. Midwives promote this practice immediately after birth. 183. Midwives are not involved in postpartum care for mothers with breastfeeding challenges. True or false? Answer: false. Rationale: midwives provide ongoing support for mothers experiencing breastfeeding challenges, including guidance on latch, positioning, and managing issues like sore nipples or engorgement. They offer solutions and refer to lactation consultants if necessary. 184. Midwives can perform amniotomy, rupturing the membranes, during labor. True or false? Answer: true. Rationale: midwives can perform amniotomy if it is indicated during labor to facilitate progress. However, they assess the situation carefully and ensure that the procedure is safe for both the mother and the baby. 185. Midwives are not responsible for providing care for women with postpartum pregnancies. True or false? Answer: false. Rationale: midwives can provide care for women with postpartum pregnancies, but these pregnancies require close monitoring. If the pregnancy extends beyond 42 weeks, midwives may collaborate with obstetricians to ensure maternal and fetal safety. 186. Midwives should always encourage vaginal birth after cesarean (VBAC) for women with a previous cesarean. True or false? Answer: false. Rationale: while VBAC is an option for some women, it is not always appropriate for everyone. Midwives assess the risks and benefits and work with obstetricians to decide the best approach for each woman. 187. Experiencing labor at home, as long as there are no complications. True or false? Answer: true. Rationale: midwives are trained to provide home birth support for low-risk women, offering prenatal care, monitoring labor, and delivering the baby safely at home. If complications arise, they transfer the woman to a medical facility. 188. Midwives can diagnose gestational hypertension, but they cannot manage it independently. True or false? Answer: true. Rationale: midwives can diagnose gestational hypertension through regular blood pressure monitoring, but management often requires collaboration with obstetricians for further monitoring and treatment, particularly if the condition progresses. 189. Midwives are responsible for administering pain relief options such as epidurals during labor. True or false? Answer: false. Rationale: midwives do not administer epidurals, as these require an anesthesiologist or physician. However, midwives provide alternative pain relief methods such as hydrotherapy, massage, and breathing exercises. 190. Midwives should always encourage early cord clamping to reduce blood loss. True or false? Answer: false. Rationale: most current guidelines encourage delayed cord clamping, at least 1 to 3 minutes, to allow the newborn to receive additional blood from the placenta. Early clamping can reduce the newborn's blood volume, which is not ideal for health. 191. Midwives can provide postpartum care for women who have had a cesarean section. True or false? Answer: true. Rationale: midwives can provide postpartum care for women after a cesarean section, including monitoring recovery, supporting breastfeeding, and managing emotional well-being. However, they work alongside obstetricians to ensure medical needs are met. 192. Midwives encourage women to have regular prenatal visits throughout their pregnancy, even if they are feeling well. True or false? Answer: true. Rationale: regular prenatal visits are important for monitoring the health of both the mother and baby, even if the woman feels well. Midwives assess fetal development, provide necessary screenings, and offer education at each visit. 193. Midwives are allowed to prescribe medication for maternal health conditions during pregnancy. True or false? Answer: true. Rationale: depending on their scope of practice and certification, midwives may prescribe medications for conditions like iron deficiency anemia, gestational diabetes, or mild infections during pregnancy. However, they typically collaborate with other healthcare providers for complex conditions. 194. Midwives are authorized to perform a vaginal birth after cesarean (VBAC) in all cases. True or false? Answer: false. Rationale: not all women are candidates for VBAC. Midwives evaluate each case individually and may refer women with higher risks, e.g., uterine scarring, multiple cesareans, to an obstetrician for appropriate care. 195. Midwives can provide care during a water birth as an alternative to traditional delivery. True or false? Answer: true. Rationale: midwives are trained to support water births, which involve laboring and sometimes delivering in a pool of warm water. Water births can offer pain relief and a calming environment, though midwives ensure safety protocols are followed. 196. Midwives should advise women to avoid all physical activity during the third trimester of pregnancy. True or false? Answer: false. Rationale: unless there are complications, midwives encourage safe physical activity during the third trimester, such as walking or swimming, to improve circulation, reduce swelling, and maintain muscle tone. 197. Midwives always recommend induction of labor for women who are 2 weeks past their due date. True or false? Answer: false. Rationale: while induction may be necessary in some cases, midwives assess each situation individually and discuss the risks and benefits with the woman. In many cases, they allow women to go past their due date if both mother and baby are healthy. 198. Midwives can offer emotional support and counseling to women experiencing pregnancy loss. True or false? Answer: true. Rationale: midwives provide compassionate care and emotional support to women experiencing pregnancy loss, helping them navigate grief and offering counseling or referrals to support groups and mental health professionals. 199. Midwives should never allow a woman to labor without continuous fetal heart rate monitoring. True or false? Answer: false. Rationale: continuous fetal heart rate monitoring is not necessary for all women. Midwives often use intermittent fetal heart rate monitoring in low-risk pregnancies and reserve continuous monitoring for situations where there are concerns about fetal well-being. 200. Midwives are trained to assess the newborn's reflexes as part of the newborn examination. True or false? Answer: true. Rationale: midwives assess newborn reflexes, such as the Moro reflex, rooting reflex, and grasp reflex, as part of their initial newborn exam. These reflexes help evaluate the baby's neurological development and health. 201. Midwives are not trained to manage maternal hemorrhage following birth. True or false? Answer: false. Rationale: midwives are trained to manage minor to moderate postpartum hemorrhage with techniques like uterine massage, administering oxytocin, and monitoring vitals. In cases of severe hemorrhage, they collaborate with obstetricians or transfer the patient to a hospital. 202. Midwives should routinely perform cervical exams on all women during labor. True or false? Answer: false. Rationale: routine cervical exams are not necessary unless there is a clinical indication. Midwives perform cervical exams as needed to monitor labor progress and assess the stage of labor, but excessive exams may increase the risk of infection. 203. Midwives can prescribe birth control to postpartum women. True or false? Answer: true. Rationale: depending on their certification and scope of practice, midwives can prescribe various forms of birth control to postpartum women, including pills, IUDs, or implants, to help with family planning and spacing pregnancies. 204. Midwives should monitor fetal movement during the third trimester of pregnancy to assess fetal well-being. True or false? Answer: true. Rationale: monitoring fetal movement is an important part of assessing fetal well-being. Midwives encourage women to track their baby's movements, as decreased fetal movement can indicate potential problems requiring further investigation. 205. Midwives should encourage pregnant women to take prenatal vitamins throughout pregnancy. True or false? Answer: true. Rationale: midwives recommend prenatal vitamins to ensure women receive essential nutrients such as folic acid, iron, and calcium to support both maternal and fetal health during pregnancy. 206. Midwives are responsible for administering antibiotics to prevent Group B streptococcus, GBS, transmission during labor. True or false? Answer: false. Rationale: while midwives can screen for GBS, the administration of antibiotics during labor is typically done by obstetricians or hospital staff. Midwives collaborate with medical professionals to manage GBS-positive women during labor. 207. Midwives always recommend the use of an epidural for pain relief during labor. True or false? Answer: false. Rationale: midwives support a variety of pain management options, including natural methods like breathing techniques, hydrotherapy, and positioning. They respect women's birth plans and preferences and provide individualized care for pain relief. 208. Midwives can perform a vaginal exam to check for ruptured membranes. True or false? Answer: true. Rationale: midwives perform vaginal exams to check for ruptured membranes, which can help assess whether labor is progressing and if interventions, like amniotomy, may be necessary. 209. Midwives should never encourage home births in high-risk pregnancies. True or false? Answer: true. Rationale: midwives do not recommend home births for high-risk pregnancies, as these require specialized care that is best provided in a hospital setting. Women with conditions like preeclampsia, multiple gestation, or certain complications are advised to give birth in a hospital. 210. Midwives are trained to assess and provide care for maternal mental health during pregnancy and postpartum. True or false? Answer: true. Rationale: midwives are trained to screen for mental health issues such as depression or anxiety during pregnancy and the postpartum period. They provide emotional support, counseling, and referrals to mental health professionals as needed. 211. Midwives should always encourage women to deliver in a hospital setting, regardless of the birth plan. True or false? Answer: false. Rationale: midwives support women's choices regarding birth settings. For low-risk pregnancies, midwives may offer home or birthing center deliveries, while ensuring safety protocols are followed and transferring to a hospital if necessary. 212. Midwives can offer education on the use of a birthing ball for improving labor comfort. True or false? Answer: true. Rationale: midwives often recommend using birthing balls to help improve labor comfort, as they encourage better positioning, relieve pressure on the back, and may help with the progression of labor. 213. Midwives are not trained to handle emergency situations during labor, such as shoulder dystocia. True or false? Answer: false. Rationale: midwives are trained to manage emergencies, such as shoulder dystocia, using techniques like the McRoberts maneuver and suprapubic pressure. They also know when to transfer care to an obstetrician in complex cases. 214. Midwives should provide education on the signs of preterm labor to pregnant women. True or false? Answer: true. Rationale: midwives educate women on the signs of preterm labor, such as contractions, pelvic pressure, and lower back pain. Early detection of preterm labor can help prevent or manage premature birth. 215. Midwives are responsible for administering vaccines to pregnant women, such as the flu vaccine. True or false? Answer: true. Rationale: midwives can administer certain vaccines, like the flu shot, to pregnant women as part of routine care. Vaccinations help protect both the mother and baby from preventable illnesses. 216. Midwives should recommend bed rest for all women with a high-risk pregnancy. True or false? Answer: false. Rationale: bed rest is not universally recommended for high-risk pregnancies, as it can sometimes lead to complications. Midwives assess each case and may recommend modified activity or other interventions based on the woman's condition. 217. Midwives should always encourage breastfeeding within the first hour after birth. True or false? Answer: true. Rationale: midwives promote breastfeeding within the first hour after birth, known as the golden hour, as it helps establish breastfeeding, promotes bonding, and regulates the baby's body temperature. 218. Midwives can offer advice on infant sleep practices, such as safe sleep environments. True or false? Answer: true. Rationale: midwives provide education on safe sleep practices, including placing infants on their backs to sleep, avoiding soft bedding, and ensuring a firm mattress to reduce the risk of SIDS, sudden infant death syndrome. 219. Midwives can perform a blood pressure check to assess for preeclampsia during prenatal visits. True or false? Answer: true. Rationale: monitoring blood pressure is an essential part of prenatal care. Midwives check blood pressure at each visit to screen for preeclampsia, a condition that can lead to serious complications if not managed. 220. Midwives should only support spontaneous vaginal births and not assist with medical interventions. True or false? Answer: false. Rationale: midwives support vaginal births, whether spontaneous or assisted. If necessary, they may provide interventions such as vacuum extraction or episiotomy to assist in the birth process, especially when complications arise. 221. Midwives should encourage pelvic floor exercises to prevent urinary incontinence after childbirth. True or false? Answer: true. Rationale: midwives recommend pelvic floor exercises, such as Kegel exercises, to help prevent urinary incontinence and improve recovery after childbirth by strengthening the pelvic muscles. 222. Midwives should never attend to women who have been diagnosed with a breech pregnancy. True or false? Answer: false. Rationale: midwives can manage breech pregnancies in certain circumstances, particularly if the breech is diagnosed late in pregnancy and there are no other complications. They may attempt external cephalic version, ECV, or refer to an obstetrician if needed. 223. Midwives can provide emotional support for families after a stillbirth. True or false? Answer: true. Rationale: midwives offer emotional support and counseling to families after a stillbirth, helping them cope with grief, providing information on funeral arrangements, and referring them to mental health services or support groups. 224. Midwives are not trained to handle postpartum complications such as deep vein thrombosis, DVT. True or false? Answer: false. Rationale: midwives are trained to identify and manage common postpartum complications, including DVT. They assess for signs such as swelling, redness, or pain in the legs and collaborate with other healthcare providers if further treatment is needed. 225. Midwives should always conduct a postpartum checkup for mothers within the first 24 hours after delivery. True or false? Answer: true. Rationale: midwives conduct postpartum checkups within the first 24 hours to assess the mother's physical recovery, including monitoring vital signs, uterine tone and lochia, and offering breastfeeding support. 226. Midwives can prescribe antibiotics for infections, such as urinary tract infections, UTIs, during pregnancy. True or false? Answer: true. Rationale: depending on their certification and legal scope of practice, midwives can prescribe antibiotics for mild infections such as UTIs during pregnancy, ensuring safe treatment for both the mother and the baby. 227. Midwives should avoid providing care for women who are HIV positive. True or false? Answer: false. Rationale: midwives provide care for women who are HIV positive, ensuring they receive appropriate prenatal care, medication, and education to reduce the risk of transmission to the baby. They collaborate with obstetricians and infectious disease specialists for complex care. 228. Midwives can provide care to women in labor at birthing centers, but not at home. True or false? Answer: false. Rationale: midwives can provide care in both birthing centers and home birth settings for low-risk women. They assess each woman's pregnancy and determine the safest environment for labor and delivery. 229. Midwives should advise women to monitor their blood sugar levels regularly if they have gestational diabetes. True or false? Answer: true. Rationale: midwives educate women with gestational diabetes to monitor their blood sugar levels regularly, helping to manage the condition and reduce the risk of complications for both mother and baby. 230. Midwives should always recommend that women stay in bed during the early stages of labor to rest. True or false? Answer: false. Rationale: midwives encourage women to remain mobile during early labor to help progress the birth and reduce discomfort. Movement, such as walking or using a birthing ball, can help the baby descend and promote dilation. 231. Midwives can assist with postpartum family planning methods, such as IUD insertion or implant placement. True or false? Answer: true. Rationale: depending on their certification and scope of practice, midwives can assist in postpartum family planning, including placing intrauterine devices, IUDs, or implants, to help women with contraception options after childbirth. 232. Midwives are required to be present at all home births to ensure safety. True or false? Answer: true. Rationale: midwives are trained to attend all home births to monitor the safety of both mother and baby. They ensure that emergency protocols are in place and transfer the mother to a hospital if necessary. 233. Midwives should avoid performing prenatal screenings, such as ultrasound, for women in their care. True or false? Answer: false. Rationale: Midwives perform some prenatal screenings, such as blood pressure checks, urine tests, and fetal heart rate monitoring. They may also refer women for ultrasound screenings when necessary, though they do not typically perform ultrasounds themselves. 234. Midwives should encourage women to rest during the second stage of labor to conserve energy for pushing. True or false? Answer: true. Rationale: during the second stage of labor, midwives often encourage women to rest between contractions to conserve energy for pushing. Resting can help women maintain their stamina and focus when it's time to deliver the baby. 235. Midwives are not trained to assess and manage the risks of postpartum depression. True or false? Answer: false. Rationale: midwives are trained to assess the risk of postpartum depression during the postpartum period. They use screening tools and offer emotional support, referrals to counselors, or connect women with mental health professionals as needed. 236. Midwives should educate women about pelvic health, including the importance of pelvic floor rehabilitation post-birth. True or false? Answer: true. Rationale: midwives provide education on pelvic health and rehabilitation after birth, including exercises to strengthen the pelvic floor and reduce the risk of urinary incontinence and prolapse. 237. Midwives should encourage all women to undergo routine amniocentesis during pregnancy. True or false? Answer: false. Rationale: amniocentesis is typically offered to women at higher risk for genetic conditions or birth defects, not as a routine procedure. Midwives counsel women on the risks and benefits and refer to specialists if necessary. 238. Midwives are trained to assist in managing labor in water, which can provide pain relief and enhance relaxation. True or false? Answer: true. Rationale: midwives are trained to support water births, as they can provide pain relief, enhance comfort, and reduce anxiety for laboring women. They ensure safety during water labor and delivery. 239. Midwives should discourage women from using epidural anesthesia during labor. True or false? Answer: false. Rationale: midwives support informed choice and encourage women to explore all pain management options. They educate on the benefits and risks of epidurals, but do not discourage them if a woman desires one. 240. Midwives can provide preconception counseling to women planning for pregnancy. True or false? Answer: true. Rationale: midwives are trained to offer preconception counseling, providing advice on nutrition, lifestyle changes, and health assessments to optimize a woman's health prior to pregnancy. 241. Midwives should always conduct regular fetal movement checks in the third trimester of pregnancy. True or false? Answer: true. Rationale: midwives encourage women to track fetal movements, as reduced fetal movement can be an early indicator of fetal distress or complications. 242. Midwives should encourage women to avoid all medications during pregnancy to prevent any potential risks. True or false? Answer: false. Rationale: midwives provide evidence-based guidance on medication use during pregnancy, ensuring women understand the risks and benefits. Certain medications, such as prenatal vitamins, are necessary for maternal and fetal health. 243. Midwives are qualified to administer epidurals for pain management during labor. True or false? Answer: false. Rationale: epidurals require administration by an anesthesiologist or physician. Midwives can offer other pain relief methods, but do not administer epidurals. 244. Midwives are trained to assist women through the process of postpartum hemorrhage. True or false? Answer: true. Rationale: midwives are trained to manage postpartum hemorrhage by performing uterine massage, administering medications, and using other techniques to stop excessive bleeding. If needed, they transfer the woman to higher-level care. 245. Midwives should always recommend vaginal delivery over cesarean section, regardless of the circumstances. True or false? Answer: false. Rationale: midwives encourage vaginal birth for low-risk pregnancies but support medical decisions when necessary. In cases of fetal distress, maternal health concerns, or other complications, a cesarean may be recommended for the safety of both mother and baby. 246. Midwives are responsible for administering medications to induce labor in women with post-term pregnancies. True or false? Answer: false. Rationale: while midwives may assist in labor induction with non-pharmacological methods, such as membrane sweeping or nipple stimulation, they generally work with obstetricians to administer medications like oxytocin for induction. 247. Midwives should always perform routine episiotomies during labor to reduce the risk of perineal tearing. True or false? Answer: false. Rationale: routine episiotomy is not recommended unless medically necessary. Midwives are trained to help manage perineal tearing with perineal support and massage during delivery. 248. Midwives can assist with vaginal exams to assess labor progression and fetal positioning. True or false? Answer: true. Rationale: midwives are trained to perform vaginal exams to assess cervical dilation, fetal position, and other factors that help determine labor progression. 249. Midwives should always recommend immediate postpartum contraception to all women after childbirth. True or false? Answer: false. Rationale: midwives discuss contraception options with women after childbirth, but respect individual preferences and timing. Some women may prefer to wait before starting contraception, while others may choose immediate options like IUDs or implants. 250. Midwives are qualified to diagnose and treat common pregnancy-related conditions, such as morning sickness or gestational diabetes. True or false? Answer: true. Rationale: midwives can diagnose and provide management for common pregnancy-related conditions, such as nausea and vomiting and gestational diabetes. They provide care within their scope of practice and refer to specialists when necessary.